5 on your mental health tonight. A major drop in the number of Americans dying from a drug overdose. The CDC is now reporting in 2024 there were around 80,000 deaths. That's actually a 27% decline from the year before. It is the lowest total in the past 5 years. That is encouraging. Joining us now is Dr. Alice Connors-Kellgren, a clinical psychologist at Tufts Medical Center.
Hey, doctor, it's great to see you. So experts say, obviously, as Maria said, it's encouraging, but still 80,000 is a large number. And any decline is certainly encouraging. So what can you tell us about the reasons?
Yeah, so substance use is an extremely complex issue with a lot of factors. So it's difficult to pinpoint the specific reason, and there's probably a number of them. So experts in the field have a few hypotheses. One is that there's been a lot of investment by government agencies in harm reduction and treatment efforts, including wide availability of naloxone, safe use sites, and increased rehab capacity. In addition, fewer people are beginning to use in the first place because of education and prevention efforts. And then finally, there are likely changes in the supply that are making the experience of using drugs less enjoyable for people and maybe pushing them to feel more ready to get help for their addiction.
Doctor, you mentioned naloxone. Why do you think that drug has been an effective tool?
So naloxone is also known by many people by the brand name Narcan, and it's a rescue drug that counteracts the effects of opioids and can reverse an overdose as it's happening. It's been a big help in preventing overdose deaths, not just because it stops overdoses in the moment, but because it can give people a chance to engage in treatment or return to treatment after a relapse.
Doctor, as you know and as everyone knows, there are many layers to help. Right now here in Massachusetts, is there enough help available for everyone, anyone who wants it for substance abuse?
That's a complicated question. So there are a lot of different types of help that are available in Massachusetts, but it can be difficult for people to access the kind of help they need when they need it. So for example, it's really important to kind of strike while the iron is hot and get someone into a detox or a rehab facility right when they're ready. Oftentimes there can be a significant wait times for these programs. And part of that is that there's like a workforce shortage for substance abuse counselors and other specialists due to low pay and difficult working conditions. So ultimately, it's a funding issue, right? And this is a problem that affects all of us in the Commonwealth and the country and really requires a lot of investment.
Yep, good point, Dr. Connors-Kellgren. Thank you so much. Stay well.
Thank you,
Doctor. We appreciate it.
Take care.
Thank you.